months ago, you'll recall, the federal government's new system of personal health records was in the spotlights. Now, many of you, I have to say me included, weren't happy with how our information could be accessed under the scheme. And despite assurances by the Health Minister, I wasn't convinced that the promised privacy protections would be adequate. All that, with a change to the legislation down the track, access would inevitably be expanded. At the time, there were also a lot of complaints at the opt-out rather than opt-in nature of the scheme. I've wondered for a while how it was all progressing. I have to declare here that I was one of those who chose to opt out in the end, and I'm glad I did, because it's clear in reports today that the scheme has significant teething issues, with 4 in 10 people who agreed to host a My Health record have said they've got no way of accessing their information. And there's plenty of other worrying information in today's report. Joining me tonight is the journalist who broke this story, National Health Reporter at Newscorp Australia, Sue Dunlevy. Sue, thank you very much for your time. I was saying to people off air, and I'll say it on camera, you are the go-to person on a lot of these big social policy issues, so I'm really pleased to have you on air with my viewers tonight. Take me through the issues, the teething problems that you explored today with the My Health record.
Okay, Peter, well, this record was introduced 7 years ago under the previous Labor government, and originally it was an opt-in system. So if you wanted one of these records, you could tell the government you did and it would set it up. But that changed under this Liberal government when they decided to turn it into an opt-out system. They did that because very few Australians had actually bothered to set up one of these records. Doctors weren't using it. They thought if they made it opt-out and most Australians had one, it would become a more useful part of the health system. The problem with doing that is that they didn't change the legislation governing the record, which was set up as an opt-in system. When it becomes opt-out, most Australians probably don't even know they've got this record. They probably don't know that 600,000 health practitioners, from your optometrist to your podiatrist, can access the record. It's not just your GP, it's not just your specialists.
Wow, so just on that point, so if I have really personal information about blood tests, let's say, that have got nothing to do with my eyes for the optometrist or my feet for the podiatrist, can they still look at the information that might not pertain to their specialty?
Yes, so your optometrist will be able to see if you've got a sexually transmitted disease, if you're taking drugs for a mental illness, if you maybe...
Well, that's a worry.
It is a worry, and I don't think Australians are aware of that, and they might think, well, I don't have a sexually transmitted disease now, I never had an abortion. But maybe that's the case now, but next week or next month or next year, those things could happen to you, and your My Health record will be able to tell people that that happened. Now, you can set a PIN number to restrict who can see that information.
But have people set up PIN numbers?
Well, no, because the government did a trial opt-out system in Western Sydney and in Townsville, and 95% of people, I think even 99% of people, didn't set up a PIN number. And the story that we had today shows that 4 in 10 Australians haven't even been able to access the My Health record they got on the 31st of January. And that's because to see it, you need to have a MyGov account. And
even if they wanted to now, after this show tonight, get on and put it in a PIN number, if they have one of these accounts, they may not be able to even access their own records.
That's correct, because they haven't set up a MyGov account. Now, I'd advise all Australians to go and either check their record, or if they don't have a MyGov account, to set it up and check it now. Go in there, set a PIN number, make sure the information on there is correct, because very many people who have gone and checked their record have discovered that there are mistakes on it. One of the health journalists for a health IT publication discovered that she was supposedly taking a medication for a disease that she didn't have. And this happened to her twice because her pharmacist had accidentally put someone else's PBS data onto her record. And if, for example, if you were supposedly taking warfarin, if a mistake had been made, they may not want to operate on you in a hospital in an emergency because
because it's a blood thinning agent.
That's right, your blood wouldn't clot. So mistakes are on those records, and you need to go and make sure that the information on your record is correct.
Has the government indicated in any way they're going to tidy up some of these issues, make it easier to access? I mean, are health professionals saying now that these records are a good thing? Are they useful?
Well, I think 92% of GPs have registered to use them, but that doesn't mean they are actually using them. I think it's only 1 in 8 of them have actually got a summary of a person's health conditions on them. So the other 7 out of 8 are pretty useless. Most doctors I speak to say that they don't find it useful. If your GP already has records about your health on his computer, it's useful to a specialist that he refers you to, but even the Australian Digital Health Agency admits that very, very few specialists are actually registered to use them in their offices. So they're not looking at them. I think only 55% of private hospitals are registered to use them, and 1 in 4 public hospitals still aren't hooked into the system. And that's 7 years after the scheme was set up. So it's rolling out very slowly. Now, I think there probably is a role, particularly for elderly people with chronic illnesses, for an electronic health record. But I think we need to be very careful, and we need to have another look at the privacy protections contained in this record. You know, the government says it's military-grade security, but 600,000 health practitioners can look at it. We already know that there's history in...
And that's not a question of being hacked too. I mean, they can have all the security they like, but if it's so porous at the end, at the user end or the reader end, it could be any one of these practitioners.
That's right.
That's
or
the
a member
problem.
Of their staff who has access to
Correct. So there's
credentials.
no amount of military-grade security is going to stop your podiatrist, if you haven't set up a PIN number, accessing things about the rest of your body that, you know, wouldn't be good for them or necessarily they need to know to treat your immediate issue. And
we already know that nurses and staff in hospitals do take a sneaky look at people's health records. It happened back in 2016 when...
Same issue with police. We know it happens.
Yes.
We know it happens. Look, nothing you've said tonight has made me change my view that I'm better to be opting out than opting in. Just before we go, deeming rates. A lot of talk today that our deeming rates need to change. How do they work? Who sets the deeming rate? Just explain for people. And do you think they need to be altered?
Well, definitely they need to be altered. I think it's very unfair that the government has set the deeming rate at a level that you cannot actually obtain in the marketplace if you're trying to put your savings away in a term deposit account. So there's about 300,000 pensioners, I think, who are affected by this. I know my own father-in-law is one of them. The government tries to encourage people to make a return on any money that they have in addition to their pension, so it deems it sets a rate that it says that you should be able to earn on the market. Now, the last time this was set by the Department of Human Services, it was back in 2015. It hasn't been adjusted since then, even though interest rates have plummeted.
And just so people at home understand, whether or not you earn the money on your investments is immaterial. They deem you to have earned, in this case, a much higher rate of return on your investment. So it impacts on people being able to receive the pension, even though that money is not being received by them, even though they're not earning what they're said to be earning, and it might knock them out of the pension.
Well, the example is if you've got $100,000, the government deems that you get $3,250 a year interest on that money. In fact, in the marketplace, you can only get about $2,000 a year interest on that money, and that can affect the rate at which your pension is withdrawn, and you end up out of pocket. I think one analysis has suggested some people could be up to $3,000 a year worse off as a result of these rules.
Well, this will be the next big issue I think the government needs to deal with, but it won't go away. And I think particularly as there's pressure on the RBA and we've seen the reduction in the cash rate, this is where the real issue is for people who are trying to earn some income. Sue Dunlevy, thanks very much for your time.
Thank you.